just want to give a brief warning that this video is going to be talking about trauma, what it is, and some tips for recovery. This can be a triggering topic for some individuals. So please take care of yourself. Put yourself first and make a healthy choice for you, whether you want to continue watching or stop now. Trauma is a complex and deeply impactful situation that affects millions of people worldwide. Whether it is the result of a singular event or prolonged exposure to overwhelming circumstances, trauma can leave lasting scars, not only physically, but emotionally and psychologically as well. In this video, we're going to dive into the world of trauma, understanding what it is, and explore 7 effective strategies for healing and recovery. So what is trauma? Broadly, trauma can be described as a physical, emotional, or psychological response to an event or a series of events that overwhelm an individual's capacity to cope. Trauma can take many forms, including acute trauma, chronic trauma, and secondary trauma. Acute trauma is a trauma that comes from a singular event, such as a car accident, a natural disaster, or a physical assault. Chronic trauma, also known as complex trauma, arises from prolonged experience to continuous or repeating traumatic events, such as ongoing domestic violence or childhood abuse or neglect. Secondary trauma is when an individual is exposed indirectly to a traumatic event. This often happens in context to people's work. Professions such as healthcare professionals, emergency response personnel, and even mental health therapists are often exposed to recurring traumatic events. This can result in secondary trauma. How does trauma impact the individual who has experienced it? Trauma can have a profound impact on every aspect of a person's life. Let's review 5 common effects of trauma. Trauma can result in emotional dysregulation, which is intense and unpredictable emotional overwhelm. This can include feelings like anxiety, depression, anger, guilt, and even shame. Trauma can also manifest itself as physical symptoms. Headaches, stomach aches, sleep disturbance. These are common with people who have experienced trauma. Some individuals experience dissociation, which is a feeling of disconnected from yourself or reality. This is a coping mechanism that sometimes the brain just naturally goes to help protect you from the trauma you have experienced. Trauma survivors may become hyper alert and easily startled. They may feel constantly on edge as if something bad is about to happen. Traumatic experiences can often lead to difficulties with trust, communication, and emotional intimacy. This can take a great toll on a person's relationships. Now that we've talked a little bit about trauma and what it is and how it can impact a person, let's get into how you can heal from trauma. The journey to healing from trauma is highly individualized and can take some time. There are several evidence-based strategies to help recover from trauma. Let's take a look at 7 of the strategies that you could implement to start your healing journey today. The first thing that you can do to start your healing journey is to seek professional help. Trauma therapy, including cognitive behavioral therapy, eye movement desensitization and reprocessing, or EMDR, and dialectic behavior therapy are all evidence-based therapies that you can participate in to help heal from trauma. Number 2 is build a support network. Connecting with supportive friends and family can build a foundation for trauma recovery. Support groups are also a great way to connect with others who have had similar experiences. Number 3 is prioritizing self-care and positive activities. Engaging in activities such as exercise, meditation, relaxation, and mindfulness, these can all help with the emotional regulation and stability. Number 4 is understanding your triggers. Triggers are situations or other kinds of stimulus that remind you of your trauma. Identifying and understanding your triggers can empower you to manage and reduce their impact. Number 5, practice patience. Healing from trauma is not linear. Setbacks happen and should be expected. Be patient with yourself. Acknowledge that healing is a process and not a singular event. Number 6 is safety and boundaries. Establishing a sense of safety and healthy boundaries in your life can be crucial to rebuilding trust and security. And number 7, artistic expression. Engaging in creative activities such as art, music, or writing can help you to process complex emotions that may be difficult to verbalize. Healing from trauma is a challenging but ultimately transformative journey. It's important to remember that many individuals do recover and go on to live fulfilling, enjoyable lives. If someone you know is suffering from trauma, don't hesitate to reach out for some professional help. With time, patience, and the right resources, you can emerge from your trauma stronger and more resilient than ever before. Thanks for watching. Click on the next video if you like this content.